All right.
Okay, thank you. All right, guys, so with this run-through of models, we're going to look at some structures of the respiratory system. Okay. This is our flat-packed model. I like to call it the half head. Here's the nasal cavity. This is the nasal cavity, all this right here. Okay. Now, within the nasal cavity, you guys remember from lecture we talked about all the concha. So you have the superior, middle, and inferior nasal concha. And they just go in that order. So we got superior, middle, and inferior nasal concha. So the superior most bump, that's the superior concha, and so on and so forth. Okay? So superior, middle, inferior nasal concha. Now what's interesting about these nasal concha is that there's actually spaces between each concha. And each space, I'll use this little paper clip, each of these spaces right here, and right there, are called the meati, or meatises. Okay? So you have a meatus there, and a meatus there. That's where the paranasal sinuses drain. And if you guys remember identifying some of those paranasal sinuses back in bones, in Bio 201, we talked about the frontal sinus, which was this space within the frontal bone. Okay? We talked about the sphenoid sinus, which was a space in the sphenoid bone. And we also have an ethmoid sinus, which is this little dot right there. Okay? Over by where the ethmoid bone is. Now, there is a maxillary sinus as well, but it's more lateral, so you're not going to see it in this mid-sagittal cut. Right? That's up by your upper molars. Okay? Now, we also have an oral cavity right here. Now, you can't see really much of the cavity because the tongue is in there and the mouth's not open. Okay? But this little space right there is the oral cavity. Now, some structures we can see in the oral cavity would be like the hard palate. And I feel like we've discussed this already, but here's the hard palate. Okay? Now, just posterior to the hard palate, we've got the soft palate, which is the part of the palate that's not bony. So there's no bones here. Okay? In fact, hanging off the soft palate, we've got the uvula, which is that little thing that dangles in the back of your oral cavity, right in the mid-sagittal line. And we talked about the digestive system and how it prevents you from getting food and water up into your nasal cavity. Exactly. Or milk. Now, in the posterior part of the nasal cavity, we're going to get something called the nasopharynx, which is pretty much between my fingers here. That's the nasopharynx. Okay? So pretty much from the base of the uvula to where my finger is, right there, that's the nasopharynx. Okay? Now some structures we can see in the nasopharynx. For one, this orange thing. Okay, that's the pharyngeal tonsil. So that orange structure there is the pharyngeal tonsil. That's in your nasopharynx. Another thing we can see in the nasopharynx is the opening to the pharyngeotympanic tube. Okay? Can you coil that for me? Now the opening to the pharyngeotympanic tube is in the nasopharynx. Remember, the pharyngeotympanic tube is, is a structure that connects the middle ear to the nasopharynx, and that's the opening right there in front of my, what do you call this again?
Chenille stick.
A what?
Chenille stick.
A chenille stick. So right in front of my chenille stick, right there, that little hole is the opening to the pharyngeotympanic tube. So you guys see that hole? That's the opening to the pharyngeotympanic tube. That's what connects your middle ear to the nasopharynx. Okay? Now, just inferior to the nasopharynx, in the back of the oral cavity, that's the oropharynx. So all that space right there is the oropharynx. Okay? So it pretty much goes from the uvula to the top of the epiglottis. Now, below the epiglottis, that's all laryngopharynx right here. Okay, so you got laryngopharynx there, oropharynx here, and then nasopharynx there. Okay? So it's really more just like little zones. Now, that's really what we can see on this model. And next I'll talk about the larynx model. Now, I love this model because it's just huge. And obviously it's nowhere near the size of like a normal human's larynx. Like this could be like an elephant's larynx or something. Maybe elephants have bigger larynxes, I don't know. But the larynx is your voice box. It's right here in the anterior side of your neck. You can if you talk, you can actually feel it kind of vibrate because that's where your vocal cords are and they're vibrating. Okay. Now this top part of the larynx here is the hyoid bone, This serves as an important attachment point for some of the ligaments of the larynx, as well as some different muscles that are used for swallowing. So this is the hyoid bone. Now this broad anterior cartilage here is the thyroid cartilage. Okay, so this is thyroid cartilage. The thyroid gland doesn't sit right on top of the thyroid cartilage. It's just called the thyroid cartilage here. Okay, and this little anterior bump on the thyroid cartilage, that's the laryngeal prominence, or like your Adam's apple. Okay, so the laryngeal prominence is that anterior bump on the thyroid cartilage. Now, just inferior to the thyroid cartilage, we're going to have cricoid cartilage, which is this. So here's cricoid cartilage, okay, which is a separate cartilage from the thyroid cartilage. In fact, if you guys remember from lecture, that's this little white tissue between the thyroid and cricoid cartilages. That's the cricothyroid ligament, and that's where you can do a cricothyroid trach tube, right there. So there's a little kind of a soft spot there. We can open up a new air hole, to put it so eloquently. Some other structures we can see on the larynx would be like your epiglottis. Normally these models have epiglottises, like it's on this large flap back here. For some reason this model is looking kind of beat up. It's missing its epiglottis. I think we have another one like this that does have an epiglottis, but basically it's going to look like a little tongue up here. Now where we can see the epiglottis on the half head is right here, just below the tongue. Remember, it's just that structure that's the superior part of the larynx there. Okay, that's a cross section of the epiglottis. Now, something else we can see are the vocal cords. If you guys remember, we have the true and false vocal cords. Now, on this model, it just shows the true. Okay, now before this model was beat up, you used to be able to kind of move these arytenoid cartilages around. You can see how the vocal cords could actually kind of open and close, but somehow, like last fall, this thing got messed up. I don't know what happened. We got in a fight or something, but these here are the true vocal cords. Okay, they're pretty large. They're kind of the more rubbery portions right here. Is the true vocal cords. Okay, now the false you can't see on this model. The false vocal cords we're going to see on the half head, and that's the superior most of these two lines. So the two lines here, the inferior one is the true vocal cord, the superior one is the false vocal cord. Remember it's called the vestibular fold, and together both the true and false vocal cords form your glottis. Okay, so those two together form your glottis. So we have the true vocal cord and the false vocal cord. Okay. Now, some other structures we'll see. Oh yeah, I'll show it here, you guys. So this tube right here, just inferior to the larynx, is the trachea. Okay. Now on the trachea, we got some tracheal cartilages. And that's each of these rings here. So that's tracheal cartilage. So is that one. So is that one. And all these tracheal cartilages help support the structure of the trachea, and they keep that trachea open so when you're like inhaling, it doesn't collapse closed, like it doesn't snap shut. Okay? So those are tracheal cartilages, also called C-rings. Okay? This is the trachea itself. Now we can see this on another model on here. So this is our nice little trachea model. So this is an anterior view. This is a posterior view. Okay? We can tell this is anterior because we actually can see some complete cartilages. From the posterior view, we see a lot of red stuff. That's trachealis muscle. Okay, so that's the muscle you're going to find in the posterior part of the trachea. So this is the trachea itself. You have tracheal cartilages, which are kind of like little C-rings that go all down the trachea, and eventually the trachea splits into two. We'll get a right primary bronchus and a left primary bronchus. These are also called the main bronchi. Okay? And if you look here, you see the right primary bronchus is actually larger and steeper than the left primary bronchus. That's a good way to tell. Okay? We can also tell this is the right primary bronchus because this is the anterior view, and this is on the right side of the model from the anterior view. Okay? So right primary bronchus, left primary bronchus. Now what's interesting about the right primary bronchus, it's wider and steeper than the left primary bronchus, which means that when you inhale something, it's more likely to go into your right lung. So like if you inhale like a Cheerio or a marble or I don't even know, something. What's like an adult thing you inhale? I'm just thinking of kids' things. I don't even know, you guys. Yeah. Okay. It's more likely to go into your right lung. In fact, smoke is also more likely to settle in your right lung. So lung cancers are more likely to occur in the right lung. And so you get, you see more lung cancers in the right lung versus the left lung because the right main bronchus is wider and steeper. Okay. Now, the primary bronchi, whether it's right or left, splits into secondary bronchi. Okay, these are also called lobar bronchi. And these secondary bronchi are the next branch after the primary bronchi. So each one of these would be a secondary bronchus the next time it splits. So here's the left primary bronchus. This is the left secondary bronchus, where it first splits, or second time it splits. Okay. Then the tertiary bronchus are the next time it splits. So each of these little ones that have like a different color painted, those are all the tertiary bronchi. Okay? So those are tertiary. So we have primary, secondary, tertiary. Now, all those bronchi go to the lungs. So here's a model of the lungs here. And for the right lung, we got 3 lobes. On the left lung, we only have 2 lobes. I don't know where my left lung piece is, but that's okay. On the right lung, what we have here, if you look here, you see there's 1, 2, 3 segments. So superior lobe, middle lobe, inferior lobe. Okay, so superior, middle, inferior lobes. We've got 3 lobes on the right lung, and we only have 2 lobes on the left lung. In fact, the left lung is smaller because the heart is slightly offset to the left, so there's not a lot of room for a full-size lung like the right lung. So the left lung's a little smaller, and there's only 2 lobes. Okay, so there's no middle lobe. We'll just have a superior lobe and inferior lobe. Okay, if you look closely, they're separated by these little lines or fissures. Okay. Now, get a couple more structures to go over. Pulmonary arteries versus pulmonary veins. Now, an interesting point about these models is that what's represented as gray or blue means deoxygenated. And what's represented as red means oxygenated. Okay? So what's this? Is that deoxygenated or oxygenated? Deoxygenated. And the red? Oxygenated. Good. So what carries deoxygenated blood to the lungs are the pulmonary arteries. It's one of the few arteries in your body that carries deoxygenated blood. Okay? So anytime you see a little gray structure on here or blue, that's going to be a pulmonary artery of some sort on the lungs. Okay? Now, if it's red, that's a pulmonary vein, which is going to carry oxygenated blood back to your heart, away from the lungs. Okay? So red, oxygenated on the lungs, that's the pulmonary vein. Okay? Now, a couple more things I'm going to show you guys on this thing. On Margie, we got some of the respiratory muscles. If you guys remember, we had like the intercostal muscles and the respiratory diaphragm. Intercostal muscles we'll find between the ribs. And so if you guys look on here, these are the intercostal muscles. External versus internal. Okay, so the internal intercostal muscles point up. In the external intercostal muscles, the muscle fibers point down. Okay, so if you look on here, these muscle fibers that are more medial, these are the internal intercostal muscles. These are involved in exhalation. So when you forcibly exhale, you're using your internal intercostal muscle. Okay? Now more laterally, these muscle fibers that are kind of pointing downward, and they're more lateral, these are the external intercostal muscles, and these are involved in inhalation, or breathing in. Okay? That's the external intercostal muscle. So internal intercostal, external intercostal. Now, one more muscle we'll look at here is the respiratory diaphragm. So I got to take this chest plate off. And so the respiratory diaphragm is here. Okay, this is really the prime muscle of inspiration or inhalation. Okay, this is the respiratory diaphragm, and it's basically this large, broad sheet of skeletal muscle that separates the thoracic cavity from the abdominal pelvic cavities. Okay, did I get everything, you guys? All right, cool.